Hi folks, Steve the Hurricane here, and on today's episode of A Drink with the Hurricane, we're going to talk about the best referral sources for home care referrals. Cheers, A Drink with the Hurricane, the home care sales and marketing talk show that discusses all things growing your home care business. All right. So you see I'm holding the 2018 Home Care Pulse Report in my hand, and I love using this as a reference because it really gives a lot of credibility to the things that I'm going to discuss with you, because this is where to go for business. And so many people over the years have so many questions, and what I love about this particular part is you see there's different referral sources for all home care businesses, but then there's referral sources for people who are the leaders. And I always like to point out what the leaders are doing, because the goal of every home care business should be to be a leader. The leaders are people who are doing over $3 million in annual revenues. And the average leader surveyed had a $4.5 million revenue per year. So if your business is not doing $4.5 million, you should be doing the things the leaders are doing to work towards getting your business to that point. And if your business is doing that or greater, then obviously we want to make sure we're doing what our peers are doing. And so when you look at the best referral sources from the leaders, besides past and current clients, and that just makes sense. If you are good at running your business, and you're doing a certain amount of volume, by default, you've been around for a while, you have a good reputation, you should get business from existing clients or past clients. That just makes sense. That comes back to your operation. So if you're not getting referrals from existing clients or from your past clients, there's probably something going on in your organization that you need to correct. So take a good look at yourselves internally and decide what we have to do to get to a point where we start getting business from there. Now, these other referral sources they talk about on here are great places for business, things that I talk about all the time. Skilled nursing facilities. As a matter of fact, almost 10% of the people who participated said that was their number one referral source type. This was my number one referral source type when I had my home care business many years ago. And the people who said that it was their number one referral source type said that it accumulated 36% of their total annual revenue. So we're talking about almost 2/5 of all the revenue of this $4.5 million business came from skilled nursing facilities. I love skilled nursing facilities as a referral source. Now, other referral sources they talk about are assisted living communities, continuous care retirement communities, those big CCRCs, trust advisors like geriatric care managers and elder law attorneys, and then hospitals, which hospitals are very difficult. Less than 5% of all of the leaders said that was their number one referral source. Now, there are two that I didn't mention that are referral sources, but for anybody who's understood my program, anybody who's been to one of my boot camps, anybody who's one of my clients, you know that I talk about referral sources and then a power partner, which is somebody you can do a lot of business with. You're going after the same target audience and they can refer you. So this is a referral source, but if you're one of my clients, this is a power partner. And if you're not a client, you want to work with these two referral source types and turn them into power partners and really blow up your business. If you don't want to do that, contact us. We can help you, okay? That is home health and hospice. Home health, hospice, private duty. That's what I refer to as the three-legged bar stool of home-based service providers for the elderly to keep them home and out of the hospital. How do we improve outcomes? By the three-legged stool working together to support the people who don't want to be or shouldn't be in a nursing home permanently. That's us working together. That's the power partnership, all right? Now, there's two other referral source types that I'm not going to really mention on here. State Medicaid programs. That's hit and miss based on the state that you're in. If you're in a state like Massachusetts or Delaware where they have really good reimbursement, great, take the Medicaid. Arizona, another great state with Medicaid reimbursement, that's a high number. But if you're in a state like New Jersey where I'm located, where the reimbursement is like 10 cents over the cost of doing business, you have to have tremendous volume. We're talking about 400 or 500 patients or more to be able to make the kind of revenue you need. That takes a lot of resources to lay out to get paid back. I don't really recommend going after state Medicaid in that case. And then the other one is the Area Office on Aging. Again, I don't really like that because everybody goes there. And whenever you do what everyone else is doing, you're not going to get the results that you're after. So for all intensive purposes, skilled nursing facilities, assisted living, hospice, home health, CCRCs, geriatric care managers, and hospitals, that's where you want to go for business. And folks, if you can't get in these places and you need help, this is why you contact us. Let's sit down. Let's have a conversation. Let's figure out what fits within your budget and the services we offer to help you get into these places and truly blow away the competition.